Hello everyone, this is Lauren Pangold. Today I'm going to be giving a brief presentation on the ECHO communication model. This presentation is directly adapted from Team Health Physician Dr. Wolf Scheinall's presentation on the ECHO communication model. I have taken that presentation and adapted it so that it is applicable to everyone within our department. So let's talk a little bit about the patient experience and why we should care about the patient experience. So studies have shown that by improving upon our patient experience, we can directly improve upon these 4 measures. So number 1 is improved quality of patient care outcomes. I think that would be enough for any of us to care about improving upon our communication if we can deliver better quality of care to our patients. But it also shows that it increases our work satisfaction, happier patients make for happier people, better job security, and reduce medical malpractice risk, which is also important to us as well. So how do we achieve these high patient experience reviews? So it is broken down into a few components here. So number 1 is high quality experience that is delivered by the entire team. So this has to be a team effort. We cannot have a provider that's focusing on communicating with the ECHO model and a nurse that is not, or vice versa. We can't have a nurse that is focusing on the ECHO communication model and communicating well and a provider that's not. So this has to be something that is focused on by the entire team. Also, process efficiency plays a huge role in the patient experience. Seeing patients quickly, addressing their concerns quickly, discharging them quickly, definitely improves upon patient satisfaction scores, but we can't always control that. So what we use is we use communication and we use behavior to overcome some of those process efficiency issues that we will undoubtedly encounter. An excellent example of this is a patient might have been waiting for an hour for a CAT scan result to come back. If we go in that room and say, "Mr. Smith, I'm so sorry you've been waiting an hour for this CAT scan result to come back. It should be back in the next 10 to 15 minutes. Is there anything I can do for you right now?" That communication, that behavior will help overcome some of those efficiency issues. So let's talk about what patients are looking for. What do patients want to see when they come and visit us? There was a study conducted in 2004 where over 2,200 people were polled, and the results are listed in order here as far as what they were looking for. So number 1 is to be treated with dignity and respect, and I think that is something that every patient absolutely deserves and is completely non-negotiable. Number 2, listens carefully to health concerns, easy to talk to, takes concerns seriously. I kind of group those 3 together in regards to how we are communicating with our patients. Are we having, do we have good eye contact with them? Are we sitting down when we listen to them? Are we communicating with them both verbally and non-verbally when they are giving us their reasoning for coming to the emergency department? Number 5 is willing to spend enough time with you, and I put 2 asterisks here on purpose because I think this is something that we can definitely improve upon. We can't communicate well with our patients if we don't spend enough time with our patients. So I think that we need to all work on improving increased time at the bedside and increased lines of communication so that we can implement these changes. Number 6 is truly cares about you and your health. I don't think that's something we struggle with at all at Hamilton. I have seen above and beyond care given by everyone within the department to show patients how much we truly care about them. And the last one is has good medical judgment. And I found that really interesting that was last on this list because for me personally, that would be number 1 on my list. Did I have good medical judgment? Did I give good medical care? When I got to thinking about why it was last on the list, I think it's because patients expect this of us. This isn't something that they're hoping for or hoping to see. This is something that should almost be more of a guarantee to them. And so I think that's why it's listed so far down, seemingly so far down to patients. So how do we do this? How do we improve upon our communication? How do we deliver this better patient care? And the answer is that we use ECHO. So ECHO stands for Enhanced Communication Hardwired for Outcomes. We're going to break this down right here. So there's 4 components of ECHO. First is nonverbal communication, which is by far the most important component, and we'll go over on the very next slide how we go about doing that. So there's the beginning, a middle, and a close. So beginning is creating a great first impression. We only have 1 shot at doing that. The middle is kind of the meat of the visit, so gathering information, explaining the plan of care, updating our patients, addressing their concerns while they're in the department. And then there's the close, which is a final explanation and ending strong, reiterating what we've done for the patient, reiterating how we've taken care of them, and making sure that they understand what their follow-up plan is. So let's talk about how we communicate non-verbally. I'm going to read through these first, and then we're going to come back and revisit some of them. So number 1 is warm tone of voice, engaging body language, consistent eye contact, showing empathy, appropriate use of touch, relaxed bedside manner, smiling, posture, reassurance, empathy comes back again here, and then of course complimenting the patient. So we do this every single day, and whether we do it well or not is another story. But think about, what are we doing with our hands? What is our body language showing? Are we engaged with the patient? Are our hands on our hips? Do we have one hand on the doorknob trying to get out the door while the patient is still talking to us? Are our shoulders angled toward the patient, or are they angled toward the computer while we're trying to type an assessment note? So if you go down a little bit further, smiling in posture, patients when they come and see us are generally not feeling well. They don't want to see us disgruntled or having a furrowed brow. They want to see us happy to see them and welcoming, and we do that by making eye contact with them and by smiling at them when we walk into the room. That goes a long way, and I'm sure we have all been a patient at one time or another and recognize the importance of that. When we talk about reassurance and empathy, I've heard a couple of nurses say, "We're going to take great care of you today." I have literally watched the relief come across the patient's face that they already feel better and that they have instilled a confidence in us that they're going to have excellent care. So I think for us to improve upon our nonverbal communication, it's going to take some effort in recognizing what we're doing when we're doing it. So try to critique yourself a little bit. Think of yourself, how am I standing? How am I talking? What does my face show? What does my hand show? And see if that's something, if there's an aspect of this that we can improve upon on an individual level. So let's talk about first impressions. So remember, we only get one first impression, so we should always announce our entrance, knock or speak through the curtain, let the patient know that we're entering the room. Again, here we see smile, warm, friendly greeting. I think these are things that we do pretty well on a regular basis. Introduce yourself. This is a big initiative that Mike Allen is pushing right now, so make sure the nurse knows your name and your role. Hi, my name is Alex. I'll be your nurse today. You can ask for me by name if you need something. That goes a long way with the patient being comfortable within the department and knowing that they have an advocate and an ally that they can go to when they have questions or when they need something. Another thing that's very important is acknowledging the visitors. So think of yourself kind of in the reverse position in this role. If you were in the hospital with your mom, or you were in the hospital with your child, and you wanted to be involved in their care, and the nurse walked in the room, only spoke to the patient, didn't speak to anyone else, you wouldn't feel that level of involvement that you were hoping for. So I think it's important for us to recognize if it's important enough for the patient to have the visitors with them, it's important enough for us to acknowledge the visitors when they're there in the room. Another thing is summarize what you already know about the patient. So this is something that we have a huge opportunity to improve upon, especially if the patient has already been triaged. We look through the note. We know, Mr. Smith in room 12 is here for nausea and vomiting and diarrhea for 3 days. Before we even step in the room, by making sure the patient knows, "Hey, Mr. Smith, my name is Alex. I'll be taking care of you today. I heard that you've had vomiting for 3 days." He knows the background that we have already done and the work that we have already done to put in to acknowledging him and supporting him as a patient. And again, this is something that we already do. And so I think by stating that out loud to our patients, it will help them realize the effort that we already put in for them. So let's talk about the middle, or the meat of the visit. And this is definitely where the nurse plays a huge role. It is undoubtedly true that the nurse spends more time with the patient than the provider does, and this is a huge area that we can improve upon. So explain the plan of care in terms patients can understand. So I have heard many times from the nurses that the patient had no idea what the provider was saying when they left the room. So really try to take on that responsibility in breaking things down for patients. Nurses do such an excellent job of that in regards to, what exactly does it mean I'm getting lab work? What is a CAT scan? Do I have to have an IV for that? Why am I having an ultrasound? Do I need an x-ray? Am I getting an x-ray of this for what? And we need and we owe to educate our patients on what we're doing, and again, in terms that they can understand. Update the patient frequently on what's happening next. This is one of the biggest things that we can improve upon. So we have an excellent nurse to patient ratio at Hamilton, and that allows us to spend more time with our patients. And it really only takes a few seconds to pop in the room and say, hey, Mr. Smith, we're waiting on your lab work to come back, or we're waiting on your urinalysis, or we're waiting on your CAT scan results. We expect the wait time to be approximately 30 minutes or 45 more minutes or an hour, and it takes some of that stress and alleviates some of that patient frustration when they don't know what's going on and they don't know what they're waiting for. The last component to this is manage up the colleague or department. And this is something that is utilized across many different industries. And what this basically means is, especially with you guys for shift change. So if you are the nurse going off and the night shift nurse is coming on, you can say, Shelby's going to be your nurse tonight. She's excellent. She takes great care of patients. I know you're going to be in good hands. And that's what that managing up means. It means telling the patient what an excellent job is going to be done, even though you might not be the one playing that role. And that can be done with providers too. You can say, Reiko is going to be the PA today taking care of you. She does an excellent job. She's very kind. She'll be in just a few minutes. And that already will kind of present this notion to the patient that they're going to have an excellent visit and receive excellent care. So let's talk about the last component of the ECHO model, which is finishing strong. So this is our last chance to promote understanding and compliance with our patients. And this is where empathy comes and plays a huge role. So this is where we utilize those phrases. I'm glad you're doing better. I hope you had a great visit today. I'm glad that you came in to let us address your issues. Leaving on that note of empathy will leave kind of a good taste in the patient's mouth. The next bullet point says, what questions do you have? And that's how we should be phrasing this to our patients. Our patients should be expected to have questions. So rather than saying, do you have any questions? We should say, what questions do you have? Anticipating that, yes, the patient's going to have questions that we need to address. And I also think that it's our role to make sure that we get the answers to that. So if there's a question that you don't know the answer to, say we're prescribing a new medication to a patient that you're not familiar with, and they say, can I take this medication with my regular medication, or should I take this medication in the morning or at night? These questions should always be answered before the patient leaves, and this is our last chance to do that. Now, hopefully the provider has addressed these issues already, and when you go to discharge the patient, I hope when you say, what questions do you have, their only question is, how do I get out of here? But in the occurrence where a patient will come up with questions that you may or may not know the answer to, it's very important to make sure that you seek out someone who does, and we will be there to support you for that. So this also gives us the opportunity to summarize the visit and plan of care. So remind the patient what we've done. So we can say, Mr. Smith, thanks for coming in today. I'm so glad you're feeling better. The lab work looked normal. The CAT scan didn't show anything significant. So we're going to plan on sending you home with nausea medicine and a note for work for today. How does that sound to you? And that gives the patient, again, that open line of communication where they say, that sounds great. Thank you for your care. And typically that's all we're going to get out of that last question with the patient. So, and the final thing is we should end with a proper goodbye. I leave every room saying, nice meeting you today, or sometimes it's nice seeing you again with our patients that frequently visit us. That is how I leave every visit when I see a patient. And I always get the patient that says, you too, or thank you, or some sort of notion of appreciation, which also makes me feel good. And again, this allows us to say that, I'm glad you're doing better. I'm glad we were able to help you, and kind of reiterate what we have already done for the patient. So how do we manage the frustrating patients? And I've gotten this question multiple times from different nurses. And the answer is, it's still going to cost us time, energy, and effort, and it's going to be difficult. So we have the patient with unrealistic expectations, and that's when we should be communicating with them maybe more frequently than our other patients. No, sir, we will not be able to do that MRI for you today. We don't perform routine MRIs for knee injuries because it's not an emergent issue. Patients that are highly emotional. So this is when we do our nonverbal cues. So we sit down, we have a little bit of extra patience with that patient. We keep the smile on our face, even though sometimes the patient may be acting a little irrational. And then drug-seeking patients, I think, are probably the most frustrating patients. And we just have to use everything that we can to make sure that we are presenting a united front that, hey, we will not be doing XYZ for you today, and here's why. So in summary, ECHO is about behavior. Nonverbal communication is a huge influence on patient experience. We should practice echo training so that it becomes natural. None of this comes naturally, and if it does to you, I'm extremely jealous. So try to practice echo training at home, practice echo training with your patients, and remember the goal for all of this is to improve our patient care and our work satisfaction, to make our patients happier and to make us happier too. So thank you very much for listening to the presentation, guys. See you later. Bye.